Hey y'all, hey, it is me, it is your girl Nurse T, and I am coming to you with another nursing video. So for those of you who are new to my channel, I go by the name Nurse T. My background includes postoperative neurosurgery, med-surg, oncology, and hospice, and currently I am what you call a float pool nurse. So for the last 2 years, I have been float pool nursing. So in simple terms, if you don't know what a float pool nurse is, a float pool nurse is basically a nurse that shows up on a unit to help when the units are short. Okay, y'all, so in this video, I will go over some pros and some cons of float pool nursing. So if you don't mind, I have my little checklist here because I do not want to skip out on anything that I feel like is imperative when sharing about float pool nursing. So I know some of y'all are probably nurses who are currently working as staff nurses, and typically when the census is low or when it's time for someone to float, no one wants to float, right? I get it. So that was me. I was that nurse because you get in that comfort zone and you typically want to stay with the people who you know and people who got your back and, you know, a unit that you're really familiar with. Well, as a float pool nurse, I'm typically the one that's going to float everywhere. And would I say that this confidence came overnight? No. I basically been on a unit for many years and now I feel like I love nursing. All right, so let's go ahead and jump into some pros and cons. Which one you want to, let's see, which one we're going to start with first. Let's go ahead and start with the pros of float pool nursing. So we can see if later on down the line, if float pool nursing is something that you want to do. Okay, so I think after being a float pool nurse for 2 years, I feel like, even though sometimes I still have this, but I feel like it kind of helps me prevent burnout. And when I say that is because I have worked units before, which were pretty heavy units, right? And so floating to different units, it kind of give me something fresh to look forward to every day. It's just like, you know, it's like a treasure hunt. You never know which unit you're going to float to, right? Whatever. It's like a treasure hunt. You never know what you're going to get. So pretty much you never know what unit you're going to float to. So I feel like it keeps me on my feet and it never gives me that dull moment, right? All right. So let's see here. So this is, okay. So this is one of the best pros about float pool nursing. Pretty much, I guess, depends on how you look at it, is they consider to make more money. Okay, so and then I'm going to reflect on this when it comes to the cons, because sometimes you get treated a certain way because people feel like you make more money, right? So anyways, that's one positive thing, is that you pretty much, your coins are a little extra when you come in as a float pool nurse, and depending on your years of experience, the more you make. So the money is definitely a great incentive. The biggest incentive for me at this point is the flexibility of the schedule. Now, whether you're a staff nurse or a float pool nurse, mostly in healthcare, you do self-scheduling. Pretty much make our own schedules. But the difference between float pool nursing and staff nursing, when I used to work on the staffing unit, if I make my own schedule, and if everybody and their grandma making their schedules to where they only working Sunday, Wednesday, Thursday, or whatever, and nobody's signing up for Fridays, then boo-boo, they're going to take you off one of your days and possibly put you on that Friday. And they'll tell you, we have to do whatever is going to be what's right for the unit, whatever that's going to guarantee us coverage for the unit. However, if you're a float pool, then they don't mess with your schedule. Like if I'm only putting myself down every Monday, Wednesday, Friday, or every Tuesday, Thursday, Saturday, then that means that's what you're going to get. Those are my availabilities, because somebody is bound to call in on a Tuesday, Thursday, Saturday, or a Monday, Wednesday, or Friday, or any day. That's the good thing. Pretty much you have your hours, and if you want overtime, you get overtime. Okay, so another thing is what I like, and actually you could take this as a good thing or a bad thing, but one thing about me is that I felt like being on certain units for so long, you begin to have that tunnel vision, and sometimes you begin to forget what you even learned in nursing school because you've been doing XYZ for so long, right? So this is another plus for me, is that you get to float. Of course, you float into multiple units, so you're keeping your skills up to par. Keep your skills up to par and kind of basically making sure that you know you well-rounded, it just makes you more marketable. So that's a couple of, pros in itself. Being more marketable and keeping your skills up to par. So you're pretty much a jack or a Jill of all trades, pretty much. So another thing for me is when I used to work on a unit, we were required to be a part of committees, whether it's shared governance, whether it's the CHF, congestive heart failure committee, whether it's the PIP committee, the PIP skin committee, when you go around the hospital and you rotate the patients over and you checking their bottoms and everything. There's always a committee that you can join. I think it's great when you're coming out of nursing school to be a part of that kind of stuff. But after so many years of doing it, I just want to come to work, take my patients, do what I need to do, and be gone. Okay? So you don't have that over your head with joining a committee, if that means anything to you. Pretty much this last portion of this pros part, I just want to kind of go back to revisit when I was saying how you go to multiple units and keeping your skills up to par instead of having tunnel vision. So, okay, so some of the places that we flow to, you can flow to neuro units, where, you're pretty much doing NIH stroke scales like every 4 hours. We flow to cardiac units where I pretty much work with a lot of heparin drips, titrating those. We also on the CCU with the cardiac care unit, we deal with chest tubes. So if you're working in predominantly neuro unit, you might not get a patient with a chest tube. And let's say you're there for about 5 years or so. So you kind of like, when it's time for a patient to come with a chest tube, and you haven't had that experience since nursing school, you fumbling and you frantic, and you probably don't even want to accept that patient because you're scared. So, and we're going to make a video on that too, about how to be more confident as a nurse. But anyways, yeah, just you're not losing skills. You're constantly keeping your skills going. So prior to becoming float pool, I never worked in postpartum. I ain't gonna even lie to you. Like, it was like I had been a nurse for probably about 6 years before I had to float to a postpartum unit. And I'm like, oh, what is that assessment like? What checking the fundus, and so it wasn't until I floated to a postpartum unit, and I actually floated so many times I felt like I was a postpartum nurse for a second. But yeah, we don't deal with the babies, but you do deal with the moms. So getting that opportunity to work with the pregnant women, well, the women after they have babies, was a plus. People normally ask me, where do you like to float the most? Whatever. Actually, all of them are kind of like what to me. Postpartum would be one for me. I just wouldn't take an actual assignment on actually become a postpartum nurse, because then I know I gotta learn the babies, and I've been dealing with adults for so long that I'd rather be the baby mama's nurse. Now, I can't do the babies. I love the babies, but that's another set of skills that I would have to really crack this brain open and start learning all that. That's a new set of stuff. I'm used to what's normal for adults. Okay. So my next to the favorite unit that I love to flow to is ER. So we typically float in the holding area. So they call us the ER hold nurse, pretty much. All right. So in the ER, as the ER hold nurse, we basically, let's say the patient come in with a cough or a cold or cellulitis. Basically, cellulitis is like redness, warm to the touch, pain in a certain area of their body or whatever. So let's just say the person who comes in with this common cold, and they triage the person and they determine, okay, we're going to send you home with this prescription, blah, 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 you're on your way. Well, let's say that if you come in with cellulitis and they know that your workup is going to require you to be here at least 1 to 2 days or however long you need to be here, then they're going to probably be admitting you to the hospital, or they're going to place you under observation. So when they do all of that, they basically going to put you in the back to the holding area to free up the ER nurse. Basically frees up the ER nurse so that they can focus more on other patients that need to be triaged or whatever. So when they're in our care, we pretty much treat them as if they were upstairs. We get the patient. My typical thing, what I do is I go in the room, I speak to the patient, I acknowledge who I am. I pretty much do an assessment. The difference between my assessment and the ER assessment, the ER, they typically do a focused assessment. If you come in here with cellulitis, a bacterial infection of the arm or whatever, presenting to you with these signs and symptoms, they're going to focus on that. They do more focused assessments. As your holding nurse, and it depends on how fast these patients are coming, I might do a focused assessment, just to stabilize you. And then you might get a room upstairs and I have to go ahead and send you up. But if you're there with me for a number of hours, I'm going to go ahead and do a head to toe assessment. So I do my head to toe assessment, information, to put in for your pharmacy. I do med reconciliation where I ask you about your medications you're taking at home. Pretty much that. Oh, and I do an admission history. So I'll go in and go through the admission profile and do all that kind of stuff. And then I basically just kind of help take care of you until they assign you a room upstairs. When they assign you a room upstairs, either I'll put it in transportation, so transportation can come pick you up, take you upstairs, or I'll take you up myself. All right. So that's pretty much flow pool, the pros of flow pool. So I know I kind of like dabbed in other stuff too, but let's go ahead and jump into these cons. Now the cons I'm going to run through kind of quick because I don't really want to kind of be negative and elaborate on the negativity. So let's go ahead and just jump straight into the cons. Okay, so there are a few things I'm going to say that can be a negative side of flow pool nursing. So number one, you constantly float into different units to where you pretty much not really creating that bond. So it depends on how big your establishment is, your facility. If you like in the Texas Medical Center or something, you probably floating like to so many units to it's a chance that you don't flow back to that unit for months at a time. So the bond you cannot have that bond. As opposed to if you at a smaller sister hospital or whatever, you probably flow to the unit a little more frequently. You might still kind of create that bond that you have with the staff on that unit. So sometimes it can be that you don't have that bond. The next thing is like the patient load. So typically if you had to choose between giving a nurse 5 and giving a nurse 4, trust and believe the flow pool nurse gonna get that 5. And out of that 5, 1, 2 can be some pretty tough patients. Okay. Well, let's just say being fair. I typically, let's say if I come on a unit, if I got somebody hanging out the bed or doing something crazy, 9 times out of 10, I already know that's going to be my patient. Guess what? It ends up being my patient. So we typically get the patients they put on rotate and patients that people don't want to deal with. Other than that is that like people typically don't gravitate to helping you. You kind of got to pull it out of them because that's what I do. I pull it out when I need you to do something for me. If I need a witness, a cosigner for my insulin, my heparin drip or anything, trust and believe I'm going to pull it out of you. But if you one of them tense people that kind of like afraid to speak up, then this is not for you. So other than that, I just wanted to run through those cons because I don't want this video to be too long. But anyways, if you're rocking with your girl Nurse T, don't forget to hit that like, comment, and share and subscribe to my channel. So again, it's good to be back. If you got any comments, please drop them below. And yeah, tell a friend to tell another friend to come subscribe to your girl Nurse T. Talk to you later.